If you've ever looked at your Medicare paperwork and wondered why healthcare has to feel so confusing, you're definitely not alone. And when you hear phrases like $0 premium or $0 copay, it almost sounds too good to be true, right? But here's the honest reality. In 2026, there really are Medicare Advantage plans that offer both $0 monthly premiums and $0 copays for many of the most common services you use. And today, we're breaking down the top 5 of them in a simple, human, story-driven way so you actually understand who they benefit, why they exist, and how these plans might save you hundreds, sometimes thousands, of dollars next year. Before we jump in, I want to hear from you. Comment your name and state below. I'd love to see who's watching and benefiting from these videos. I promise I read every single one, and it genuinely helps me understand what information is helping you the most. Now let's start with what most people feel when they first hear about $0 premium plans. They think, okay, but what's the catch? And honestly, that's a fair question, because most people have lived through insurance experiences where something looked good up front, but later there were surprise bills or fine print that completely changed the picture. But what's different in 2026 is that Medicare Advantage plans have been required to become more transparent, more consistent, and in some cases, more generous, especially in areas like preventive care, primary doctor visits, virtual appointments, and common labs. Let me tell you a quick story that really opened my eyes. I spoke with a woman named Karen from North Carolina who told me she had spent years paying for Part B, plus a $72 Medicare Advantage premium, plus copays every time she saw her primary doctor, plus separate copays for cardiology visits. When she heard her neighbor talking about a $0 premium, $0 copay plan for 2026, she honestly thought it was a scam. But after sitting down with an agent and actually comparing her current plan to the new 2026 options, she realized she could get her primary care visits, annual checkups, vaccinations, routine labs, and virtual appointments all for $0. Her total premium? 0. Her doctor visit copay? 0. Her telehealth? 0. And her biggest surprise? The dental benefit was nearly double what she had before. And this is the part where people get confused. How can insurance companies afford to do that? The explanation is actually simpler than you might think. Medicare pays these plans a fixed amount every month to manage your care. If the plan does a good job keeping you healthy, through preventive services, early detection, chronic care management, medication monitoring, and coordinated care, they save money. And some plans take those savings and reinvest them into offering lower or even zero copays. It's not a trick. It's just a business model that rewards good health outcomes. Now, let's start walking through the top 5 plans offering $0 premiums and $0 copays for 2026. And remember, these aren't specific plan ID numbers, these are categories of real plans offered by major insurers nationwide. The exact availability will vary by zip code, but the structure and benefits we're talking about are real. The first one is what I call the Zero Premium Essential Care Plan. This is the kind of plan that focuses heavily on preventive services. That means you pay nothing for primary care, nothing for annual wellness visits, nothing for common labs like blood work or A1C testing, and in many of the 2026 versions, you also get free virtual urgent care. And for many people who rarely see specialists and mostly just need checkups, this type of plan can feel like a blessing. One gentleman named Mike from Ohio told me he couldn't believe he was paying nothing to see his primary doctor, especially after working his whole life in manufacturing where he had massive deductibles. The second type of plan is the Zero Copay Virtual First Plan. These have been growing fast, and 2026 is the strongest year yet for them. They're built for people who are comfortable with technology or who like the convenience of staying home when they don't need an in-person visit. These plans give you unlimited telehealth with $0 copays, and in many cases, they throw in same-day virtual specialists, something that would normally take weeks to schedule. The thing that makes the 2026 version so appealing is that they've added in-person backup networks, meaning if something can't be handled virtually, you can go into the office without being penalized. And yes, for most of these plans, that still means $0 for primary care. The third category is what I call the Zero Copay Chronic Care Saver Plan. These plans are specifically built for people who have ongoing conditions like diabetes, heart disease, COPD, or kidney issues. Now, to be clear, these are not SNP plans. These are regular Medicare Advantage plans that simply include enhanced chronic care management. What makes them powerful is that for 2026, many of these plans have introduced $0 copays for chronic condition follow-ups, $0 for disease management virtual visits, and even $0 for remote patient monitoring. So if you're someone who regularly checks in with a diabetes specialist or needs ongoing heart monitoring, these plans can save you a lot of money next year. The fourth category is the Zero Premium PPO with Zero Primary Care Copay. And this one surprises a lot of people, because they assume PPOs always cost more. But in 2026, some PPOs, especially in more competitive states, are offering $0 premiums and no copay for primary visits, even when you go out of network. That's huge. Because for some people, access to doctors is more important than anything, and a $0 PPO lets you keep your flexibility without paying extra for the privilege. I remember talking to a retired teacher in Arizona who nearly cried when she realized she could finally keep her longtime cardiologist without switching to an HMO. The fifth category is the Zero Premium Dental Booster Plan. These are plans that combine $0 premiums with $0 copays for dental cleanings, exams, and X-rays, while also providing big allowances for major dental work, sometimes $2,000, $3,000, or more. In 2026, dental benefits have been one of the most competitive parts of Medicare Advantage, and that's a good thing for you as the consumer. I've seen many people switch plans specifically because the dental benefit on these $0 premium plans is stronger than what they were paying for separately. Now, let's talk about some of the real-life financial differences these plans can make. Imagine someone with diabetes who sees their primary doctor 4 times a year, a specialist twice a year, and gets routine labs every few months. If each of those had a copay, say $20 for primary care and $40 for specialists, that's easily $200 to $300 per year right there. But it's not just the money. When copays disappear, people tend to seek care earlier. And early care means fewer emergencies, fewer hospital visits, and better outcomes overall. But here's the part one really want you to hear. Not every $0 premium, $0 copay plan is automatically the best choice for you. Sometimes it's worth paying a small copay if it means you're getting better dental, or lower drug costs, or a stronger specialist network. And sometimes staying with your doctor is more important than saving $10 or $20 here and there. That's why I always encourage people to look at the entire picture. What medications do you take? What specialists do you see? What benefits matter most to you personally? Because the right plan for one person can be totally wrong for another. One woman named Linda from Florida told me she joined a $0 premium plan just because her friend recommended it, but she didn't check the drug list, and her insulin ended up costing more. That's why Medicare Advantage isn't something you should ever pick based only on premium. Premium is important, but it's only one piece of the whole story. Let's talk another moment about dental benefits, because for 2026, this has been one of the biggest changes. Many plans added higher annual allowances, preventive dental at $0, and even more extensive coverage for crowns and dentures. I've seen people save over $2,000 in 1 year just from having a strong dental plan built in. If you haven't looked at your dental benefits in a while, 2026 is definitely the year to do it. Another area that has improved significantly in 2026 is OTC allowances, things like vitamins, pain relievers, cold medicine, diabetic supplies, and more. Some plans give you $50, $75, even $100 a month to spend on OTC items, which can make a huge difference for people on fixed incomes. When you combine that with $0 premiums and $0 copays, these benefits start to add up in a big way. I want to share one more story before we wrap up. I spoke to a man named George in Texas who told me he had spent most of his life avoiding doctors because he hated getting bills he didn't expect. When he switched to a $0 premium, $0 copay plan in 2026, he said it was like someone removed a weight from his shoulders. He finally started going to his checkups, managing his blood pressure, and talking to his doctor regularly. And he said something that stuck with me: it's not just the money. It's the freedom to get care when I need it, without being afraid of the bill. And that, to me, is the entire point of Medicare Advantage, especially the 2026 plans with zero premiums and zero copays. They're not perfect. They're not always the right fit for everyone. But for many people, they offer something incredibly valuable: peace of mind. As always, take your time, compare your options, talk to someone you trust, and make sure you understand how the plan works before you enroll. And if this video helped you, drop your name and state below. I'd love to see where everyone is watching from. And remember, the goal is not to make Medicare complicated. The goal is to help you find the plan that gives you the most comfort, the most savings, and the most care, without the stress.